between. We would be showing you something very innovative and very unique, wherein you may be able to take some breather. And that is coming very fast. And that is what? Non-invasive neuromodulation, repetitive transcranial magnetic stimulation. बाहर से magnetic stimulation brain को दिया जाता है. There is a coil. In the coil, you pass a current. And in that current, because of the current, there is a magnetic field induced, which stimulates the cells of the brain. So what is the evidence? In 2025, this is the most recent paper. In this randomized clinical trial, जिसमें randomized clinical trial जो होती है वो सबसे robust और स्ट्रॉन्गेस्ट प्रकार का मेडिकल ट्रायल होता है, जिसके अंदर प्रूफ जब ये आता है तभी बहुत ही सीरियसली माना जाता है. सो दे फाउंड that repetitive transcranial magnetic stimulation enhance clinical benefit of Tai Chuan in improving sleep quality and cognitive functions among older adults with sleep disorder and minimal cognitive impairment. And it may be result of altered neural plasticity, brain की functions alter करने से. Again, another very big study from Canada, multi-centric study, many centers were involved, and a very important, a very large study showed that cognitive remediation, wherein I told you about computer-based cognitive training, virtual reality, that is cognitive remediation, and non-invasive neuromodulation in the form of direct cortical stimulation had shown to be beneficial as compared to people not receiving any of this therapy in improving their memory function. Another proof of in science is a meta-analysis. When you do a systematic review and collect all the data published at that time in the literature. In 2020, a meta-analysis of repetitive transcranial magnetic stimulation showed out of 13 studies and 300 patients that the random effect, it's a type of a statistics, was quite large in favor of RTMS over sham. Sham mana non-stimulation in improving cognitive function. In 2021, another meta-analysis showed that repetitive transcranial, Deep TMS, and repetitive transcranial magnetic stimulation had significant impact on neuropsychiatric symptoms and cognition as compared to sham stimulation. We have at JustLook invested in a very advanced setup of repetitive transcranial magnetic stimulation, which is the only one in Western India. It has got high level of effectivity and precision. Again, I will not bore you with the technicalities, but you have to take my word. And my word is not my personal word. It is a word of science showing that it is more effective than routine areas of transcranial magnetic, routine RTMS or transcranial magnetic stimulation. It is called deep transcranial magnetic stimulation. And the fact is that for every disease, we have different head coil, which is a very expensive feature to have. Itself tells you that this is a very specialized, unique form of treatment. This is the setup. Again,